80% of us at some point in our life are going to experience back pain that's going to be debilitating, meaning we can't perform our normal activities of daily function. We used to think that if you had severe low back pain, the best approach was, well, let's lie in bed for a week. What studies have found is that no more than 3 days of bed rest, and for that matter, there shouldn't be solid bed rest for that 72-hour period. Lying in bed for prolonged periods of time actually will cause more stiffness. It'll cause more, less blood flow, if you will. Core strengthening is critically important when we're talking about preventive measures down the line of avoiding chronic low back pain. We need to focus whenever we're lifting something, particularly over 20, 30 pounds, we need to focus on using our muscles in our legs, not using the muscles in the back. Make sure that your feet are shoulder width apart. That's number one. Number two is you want to focus with keeping your posture upright so that your torso and your upper body is almost perpendicular to the floor, and then bend at your knees. Focusing on a healthy weight and our body mass index is very important. The American Academy of Orthopaedic Surgeons actually has a really nice website where you can see where you fit into the body mass index. If we can just focus on keeping our body basically perpendicular, the upper body perpendicular to the ground, that posture is going to save our joints in our spine, both in the neck, the thoracic, and the lumbar region. I'd like to get the message out as well about smoking and the correlation for back pain. The issue is not really the tobacco as much as it is the nicotine. The nicotine within any of these products causes vasoconstriction, or decrease in the blood flow, to the discs within our back, and those discs are avascular, meaning they don't have a blood supply. They have to depend on the vertebra above and below it to kind of diffuse the blood and oxygen through those little cells. Nicotine further constricts those blood vessels, further dampening the volume of nutrients that the discs get, and then they can rapidly degenerate.